Among all the research that's being made on hair loss in the current time, there's only one compound that can realistically achieve 100% hair regeneration from 0 to 100 back to your teenage years. And I'm not talking about pure lutamide, not talking about GT20029. I'm talking about a compound that's already FDA approved for other purposes and being researched right now as we speak for hair loss specifically. I'm talking about a compound that takes advantage of a basic body phenomenon, scarring, which I have my fair share of experience with. But before jumping right into the subject, I wanted to go ahead and subscribe to the channel to stay updated with any future hair loss treatments or research data. I post here regularly. So let's take a little step back and sort of review androgenic alopecia and why we need so much verteporfin, this compound I was talking about. We already know that androgenic alopecia is caused by the hypersensitivity of hair follicles to androgens. The most potent androgen is DHT, dihydrotestosterone. Your body makes testosterone in your testicles primarily. It also makes a little bit of a quantity of testosterone in your adrenal glands. And peripherally, meaning in the blood, there's an enzyme called 5-alpha reductase that turns that testosterone into its more potent form, its more efficient form, dihydrotestosterone, also called DHT. Dihydrotestosterone binds to hair follicles in people that are susceptible to androgenic alopecia, like myself, unfortunately, and it cuts the blood supply to that hair follicle, and the hair follicle will have no choice other than destroying itself in a matter of months. And we tried to address this problem with 5-alpha reductase inhibitors like finasteride and dutasteride, but something I often see in these hair loss forums is that people often get caught so much in this and forget the actual efficacy of finasteride. From the data we have so far, the best thing you can wait from finasteride is it to improve your hair count of 24 new hairs in each square centimeter after 1 year of using 1 milligram of finasteride daily. Dutasteride has a similar efficacy, and pyrilutamide and GT20029, although we didn't get so much data about their efficacy yet, but they wouldn't differ so much from dutasteride and finasteride. My point is, the best option you have as a hair loss sufferer who lost a lot of ground, like a lot of people who had hair loss begin in their 20s, the best option you have is having a hair transplant. But the biggest limitation with hair transplants is that people have a limited donor area. So when the surgeon takes hairs from the back of the head, from the DHT resistant area, and replaces them in front, you'll at most get maybe 5,000, 6,000, 7,000 grafts of donor area if you're lucky. Not to mention that patients who usually seek to do hair transplants usually tried pharmacological interventions like finasteride and dutasteride, and it didn't give them satisfactory results because their hair loss is usually so aggressive and is so extensive to the point that pharmacological treatment didn't solve the problem. So the majority of patients that seek to do a hair transplant already have an extensive degree of hair loss. Therefore, this problem of too little donor area is a problem that more people are suffering from more than you think. But why? Why do we lose the hair in the back of the head when we transplant it in the front? Well, we used to think that by harvesting the hairs in the donor area, we harvest the stem cells, but we know that's not true. So what's causing the hairs in the back of the head to not grow back after being harvested? Well, it all boils down to how our bodies manage wound healing. If you damage your skin in your epidermis, the outer layer of your skin, the wound healing in this case would be a simple process. The surrounding epidermal cells will proliferate and migrate to the surface, producing normal skin. But if you damage multiple layers of the skin, the process would be a little more complicated. First, your body will initiate thrombosis to stop the bleed, because at this point the damage reached blood vessels. On top of that, the actual mechanical trauma through pathways that use proteins like YAP protein will activate the fibroblasts in that surrounding environment to express the engrailed 1 gene. This gene is the one responsible for turning that tissue into a scar tissue. And scar tissue differs from normal tissues in 3 principal things. First, it has a different formation of collagen, making it having less elasticity. You could see that under microscope if you would take a biopsy from this part of my skin. By the way, this scar is a result of a surgery that I had about 2 years ago, where the surgeon had to cut this part of my skin to access the knee joint. I had a ligament reconstruction because I have torn my ACL like an idiot playing a football match. Anyways, obviously the surgeon's incision is deep enough to induce scar formation. So you can see that I have a relatively hairy leg, but this part of my skin doesn't have any hair follicles. And this is the second difference between scar tissue and healthy tissue. And the third you can only see under microscope as well, and that is scar tissue also doesn't have sebaceous glands. So less elasticity, no sebaceous glands, and most importantly for the purpose of this vid, no hair follicles is the three basic characteristics that scar tissue have and normal tissue doesn't. Now the mechanism of verteporfin is pretty straightforward. You don't have to be a nuclear physicist to understand how verteporfin works. Remember the YAP protein we talked about? The pathway that our fibroblasts use to express their engrailed 1 gene, the one that induces the scar formation. So verteporfin is an inhibitor of that YAP protein. So no YAP protein, no expression of the engrailed 1 gene, and no scar formation in the environment where otherwise scar formation should have resulted. And the great thing about this is that we have already established an efficacy profile and safety profile for verteporfin because it has already been FDA approved for over 20 years, I think, for another condition, which is neovascularization secondary to age-related macular degeneration. I know that seems complicated, but it's this condition in ophthalmology where new blood vessels form in your retina, in your choroidal layer of your retina, where the vascular layer is, and those blood vessels bleed and cause damage to your macula. Macula is the central part that is responsible for the central vision. So people suffering from this condition will have especially central vision problems. Anyways, that's off topic. I just wanted to mention that verteporfin is already FDA approved. So as soon as we get the efficacy profile and the efficacy data from the current studies that's being conducted by the gentleman I will talk about in the end of the video, we can start using verteporfin right away. It wouldn't be a lengthy process of new FDA approval because some surgeons will actually start administering it off-label. And in addition to that, we also have this paper from Science magazine, which is, by the way, one of the most prestigious magazines in the medical field. And this paper was published in April 2021. Authors here try to investigate changes in wound healing after creating a population of ENF1, engrailed 1 lineage negative fibroblasts. Basically, fibroblasts that cannot express the engrailed 1 gene, thus cannot theoretically produce scar tissue. That's the point of this investigation. And what molecules did they use to inhibit the scar formation? Guess what? Verteporfin. And the results were pretty astonishing. Well, not that we didn't already expect that, but the authors concluded that the inhibition of YAP protein by verteporfin yielded skin regeneration in 30 days with recovery of functional hair follicles and sebaceous glands. Quantitative comparison of scars and regenerated skin showed that the YAP inhibition induced full recovery of normal dermal ultrastructure. So you may be asking now, what's stopping us? Why don't we start administering it and using it in hair transplants immediately? Well, nothing really. As I said, there's a Jordanian doctor who goes by the name of Dr Barghothi. He's from Jordan and he's conducting his study in his private clinic after his patients gave consent, of course. And the results so far were as following. After 56 days of administering verteporfin prior to the hair transplant or in the duration of the hair transplant, there is some signs of hair growth, but nothing for sure so far. In the article that was published in Science magazine, normal skin regeneration was observed in only 30 days. But in the micro-study conducted by Dr. Barghothi, after 5 months, the results were not so sure. I mean, there are some people on the forum that indicated that there are some signs of normal regeneration of the skin, but I wouldn't count on it. Dr. Barghothi said that he would be doing a biopsy and providing us with the data as soon as he gets it. You can go, by the way, and follow his study in the forum Hair Restoration Network. And yeah, I don't want to say anything really because I don't have an opinion yet. I do really want to see the biopsy results so that we can see under microscope what is the collagen structure, if this tissue under microscope is similar to scar tissue or a healthy tissue. So I have conflicted feelings about this. I'm a little bit more on the optimistic side, but also I want to be vigilant and don't set my hopes higher than they should be. Also, there is a possibility that if everything went well, Dr. Barghothi said that he would do another micro study where he will try to administer verteporfin to the thinning area, not the donor area. So we could potentially use verteporfin without even doing a hair transplant. We can induce wound healing in one way or another, for example, microneedling, and administer verteporfin and provoke normal wound healing and hair regeneration without even doing a hair transplant. Again, I want to thank Dr. Barghothi if he ever watches this video. His efforts are much appreciated in the hair loss community. Also, I've heard of other hair loss surgeons that heard of Dr. Barghothi's work and got motivated to do their micro studies in their private clinics using verteporfin as well. So we could wait for a lot of data to be coming in 2023. So that's it. That's what I wanted to talk about. Don't forget to subscribe to the channel if you didn't yet. I will be posting a new video as soon as we get new data about verteporfin or any new hair loss treatment. And if you made it watching the video so far, don't forget to press the like button if you found it informative, subscribe again, and as always, stay safe.